This is exposure therapy. There are variants of exposure therapy. One is in vivo, the other one is virtual reality. In vivo, there is direct exposure of the feared stimuli. An example is someone with social anxiety can be instructed to give a speech in front of a large audience. Virtual reality exposure allows the individual to be in a computer-generated virtual environment that gives them a sense of feared stimuli in the virtual environment. An example would be someone with a fear of flying could have a virtual experience using equipment that provides similar experience of being in an airplane. Why is it significant to use exposure-based therapy? Well, social anxiety disorder and phobias are common and debilitating. If untreated, the disorder typically follows a chronic, unremitting course leading to substantial impairments in vocational and social functioning. Studies have also shown that exposure therapy is effective in the treatment of multiple psychological disorders, including phobias, anxiety, and post-traumatic stress disorder. In this study, we had the sample consisted of a 28-year-old female who desired to start a family with her fiance but was unable to attempt to conceive due to fear and anxiety about the possibility of vomiting secondary to morning sickness. The researchers sought to apply exposure-based behavioral treatment to the treatment of the young female. The patient underwent a series of exposure exercises, including watching others vomit. She didn't avoid foods that could potentially cause her to vomit, and she did attempt to elicit herself to vomit. The patient not only eliminated her avoidance of fear situations, but she also evidenced positive cognitive changes associated with fear, avoidance, and distress with vomiting. The recommendations by the authors include the use of self-report measures that were not specific to emetophobia symptoms and single subject case showing effectiveness of exposure therapy in treating emetophobia. The study was very successful in depicting the need for continued support for the CBT conceptualization of emetophobia and the use of exposure therapy as an effective treatment.